Dosing and zeroing is something that I believe is overused in many cases because there are situations outside of those protocols. There are situations outside those protocols where you might want to do a dose and a zero, but it's not all the time. And many practitioners or many people starting out will start to rapidly try and dose and zero in all these different areas. Hello everyone, Dr. Rob here. Welcome back to our Sana Institute 10-minute training. Today we're going to be talking about when to dose and zero in a clinic. And this is all about communicating with the brain to heal the body. So let's talk about what dosing and zeroing is first and foremost. So included in all of our devices is the capacity to dose and zero. Dosing and zeroing is the ability to essentially connect with the brain and ask the brain to focus on an area. For this reason, it's not something we do all the time, because really what we want to avoid doing is confusing the brain as we roll into asking it to help us with different things. So as I mentioned, different devices have the ability to have dosing and zeroing, but in different modes. So let's go through those to start with. So first off, the Genesis 2. The Genesis 2's dosing and zeroing capabilities are in the 77 hertz mode. So when you're using a Genesis 2 to dose and zero, what you're actually looking to achieve is to get the dose first and the zero second. So why is this important? So a zero and a dose are two very different things. First and foremost, a dose is when the device has sent the signal to the brain and the brain has received it. The zero is when the brain has sent a signal back. What we don't want is a zero first, which means that the brain suddenly is sending out a signal rapidly in response without actually receiving our message in the first place. It means that it's not really going to achieve anything. So in the case of a zero coming in, what we're looking for is to say that that is a false zero if the zero comes in first. Now, you have two different ways that the dosing and zeroing appears on the Genesis 2. So first off, what you're going to be looking at is the dosing, while in 77 hertz, is going to show up as a blue light, okay? A blue light will buzz on, and then it will just highlight. This is while you're in 77 hertz, holding the device in place. This means you got a successful dose. At this point, you continue to hold it in place, and then all of the other lights on the device will flash eventually, and that will lead to a zero. Now, this is your dosing and zeroing. If your green lights all come on first, then you failed. You need to pick the device up, reapply it, and try again until you get that blue light first. So that's the Genesis 2. The Evolution is actually very, very similar. I do happen to have my Evolution on hand here. But as you'll see, so as the Evolution is so similar, you essentially can set your device to the mode you want, and you're going to get a similar effect. Now, but in the Evolution, 77 hertz does not dose and zero. In fact, the only ones that do are 60 hertz and fMRSI. 60 hertz is what you're going to want to use in the sense of general body communication. If that's what you're trying to achieve, do that. If that continues to fail, then you try fMRSI. I'm just going to set the device's power on here and see if we can get a dose so that you can see what this looks like. So you need to get it to a comfortable power level on your client. Apparently, I'm not conductive today. Okay, so we'll go down here where I am. All right, so you'll see I'm in 60 hertz, and I'm holding it in place. And what I'd be waiting for is the blue light to come on. Now, the blue light can take a couple of minutes to come on. And if all the green lights come on first, you'll see that too. So really, we're going to kind of take a little bit of a wait here. We're going to talk about this process. So there you see it. There's the dosing coming on. So that would be a successful dose. It's the same kind of thing, how it looks in the Genesis 2. And then after that, you're waiting for all of the green lights to come on. That would be the zero. It'll also make a loud ringing sound. This is actually the most complex part about this, is just getting that timing up and knowing that zeroing can take some time. The dose is pretty quick, but now we have to wait for the brain to respond back. Now, this is how you do it with these devices. And rather than hold this in place here, I think I might be better suited to pull it back here so I can be a bit more comfortable for this. What about the Pinnacle? The Pinnacle has on it its backlit screen. So you'll actually see the D and the Z on the Pinnacle. And we go through this in the video trainings for those devices. But the D obviously means the dose, and the Z means the zero. So if you get the Z first, then you've got essentially a failed dose, right? You've gone to zero. So you need the D to come on first and then the Z. And you're then working in the same process. Instead of lights, you're getting the dose and the zero on the screen. So this doesn't really answer the question posed by this training, which is, when do we dose and zero in a clinic? Dosing and zeroing is something that we're going to do as a part of larger protocols. If, for example, you are doing 3 pathways and 6 points, or the abdominal protocol, or the gynae protocol, you're going to be dosing and zeroing quite a few different points. In that case, you're drawing the brain's attention to the areas that need it most, and you're also analyzing those. So you're able to essentially get the information you need to process what is going on and really make these treatment decisions for your client or for yourself. Now, dosing and zeroing is something that I believe is overused in many cases, because there are situations outside of those protocols. And just for timing here, you can see I'm still waiting for that zero. There are situations outside those protocols where you might want to do a dose and a zero, but it's not all the time. And many practitioners or many people starting out will start to rapidly try and dose and zero in all these different areas. And so what they'll be trying to achieve is, I'm just trying to get my brain to focus on the areas that are problems. But you end up sending up a lot of confusing signals to the brain. If you think about dosing and zeroing as a message that you're sending to try and get the body and the brain to heal, what happens if you're sending all of these signals? If you are trying to say, hey, this shoulder needs some attention, but then, and there's your zero. See, all the green lights came on and the blue light turned off. That is what it looks like when you get a zero on here. So if you're sending out all these signals, so I just did this on my arm. If I now go to my elbow here, and then my shoulder, and then my ribs, and I'm dosing and zeroing all of these points, I've essentially said to my brain, hey, I want you to focus on this, and then I want you to go from here, and then I also want you to focus on this, and I also want you to focus on this and this. And so you end up creating this kind of chaos system where nothing gets treated. And this is kind of a folly, because in practice, in a clinic especially, you're trying to get results fast. You maybe only are spending 15 minutes with the client, maybe 30, maximum probably an hour. So if you're trying to get the body to make change quickly, or even lasting change after they leave your clinic, you have to focus on 1 or 2 points. If you imagine that this is you being lost in a forest and shooting up a flare for help, if you shoot up a flare and then run 100 feet and shoot up another flare and then run 100 feet and shoot up another one, you're going to have a very confused rescue team that's not really knowing where to go exactly. You kind of want to stick in that area. So pick those battles with dosing and zeroing. Choose the areas that need the treatment the most so that you're able to rapidly get the response you're looking for. I would kind of leave these things to 1 to 2 points when treating a patient to get those results. And if you use the Pinnacle, use the initial reactions mode to analyze the tissue and find out where you should be prioritizing those spots. You don't really have that luxury with the Genesis 2 and the Evolution, but if you have the Pinnacle and you're treating a patient with a sore shoulder, check everywhere. Take a reading all around the shoulder, the areas that it hurts, the areas that it doesn't. Get up into the neck, get down onto the arm, check the opposite side. It doesn't hurt to take the readings, but it will be a problem if you dosed and zeroed every single tender point on their shoulder. Find the biggest one, the most inflamed number, dose and zero that. Now, the last thing about dosing and zeroing, regardless of the device, is that when you've completed a dose and a zero on an area, you most of the time are going to want to do a stimulate. We call this DZS, dose, zero, stimulate, for a reason. This is because we are dosing, so we're saying, hey, brain, this is what we need you to do. zero in, the brain is saying, okay, I understand. And then we're stimulating, we're triggering treatment in the area, making it so that the body's starting to actually heal. Now, the brain starts to see these treatment signals because it's paying attention, and it can start to mimic and replicate those in that area. So stimulate, typically if you're using the Pinnacle, you're going to use regular stimulate. It's just called stimulate. If you're using the Evolution or the Genesis 2, you're going to use blue stimulation. That's what you have. Now, beyond this, if you're using a Pinnacle, you have the option to use blue stimulation. But stimulate is a gentler approach. Blue stimulation can be used if you want to, but stimulate's the time-tested one when you have access to that. It's a bit slower, but it has kind of a deeper effect. So you want to make sure you trigger that treatment piece after you've sent the signal. So let's recap a little bit here. When do we dose in zero? We don't really want to dose in zero outside of those big protocols more than once, maybe twice. Trying to use that dosing and zero in technique to treat the highest, most damaging point in an area is going to be the best use of it. Get the brain to unblock that area and then begin treatment on it. This is so obviously effective in treatments of chronic pain that are localized, especially even with migraines and things like that, especially when they're coming from the neck. Finding that spot, dosing and zeroing it, that can fix it when nothing else is really touching it. So start to utilize this tool if you're not already. Learn more about dosing and zeroing in the library. Go in, check out the training videos, learn how this works, and start to utilize this technique as you need, but not overusing it. It's a powerful weapon that we have, and we want to pull it out for when we really need it. But we definitely don't want to start sending up those flares all over the place and causing more problems for our patients or for ourselves, or worse than anything, really, getting no results in clinic. We want to make sure we're getting those results so the patients are satisfied and happy. And of course, that's going to bring more word of mouth to get more people in your door and build your practice that way. So if you have any questions about dosing and zeroing, and you are already a member of our course, check out the training videos. You're going to find more information in there, or ask your treatment coordinator. If you're not, and you have some questions that maybe we can clear up, drop them below. We'll be happy to help that out too. There's full demonstrations of this dosing and zeroing process in our training portal. It can be challenging to get the zeros to go on camera, so I'm very glad that I did that. But anyways, I hope you enjoyed this. I hope you found it useful. I'll see you next week for another Santa Institute 10-minute training. Take care. Bye-bye.